I think I'm good.
Okay.
Hey, how are you?
Hey, how you doing?
Good.
Good. Boy, this is dark coffee here. This is gonna
Chilly. Maybe there should have some.
hang in from the rafters here. This stuff looks like.
Soft.
Hey,
How are you? Good. How are you?
good. Good. Yeah, time's kind of flying.
Yeah.
It's our deal.
Yeah. Okay, last month or something.
Yeah. How about you?
How you doing? How are you?
How'd it go?
It was good. It was fancy. We had like wine and beer and cheese plates, all that stuff, yeah.
Hi.
I texted Dr. Chu a picture, and I was like, it's getting serious. Like silver serving.
Don't joke about all the others.
Apparently there's one of them, it's like, what?
Yeah.
Now I know.
Yeah. But, so, yeah.
Like,
Yeah.
give it a drum school.
Was that your permanent stuff or?
Kind of, so this is Dr. Morris, like a redhead. She's colorectal, she's colorectal surgeon.
Yeah.
She's awesome, she's like short, she's curly, she's so fiery. She's my PI, but she works in the same division as Dr. Chu. We do a lot of overlap. He's on our VA study, Sean. So he started doing health literacy at the same time. We had wrapped up our study at VA, so we're like,
Yeah.
are you Samantha? I'm Samantha. Oh, thanks. Oh, nice to meet you. I know, nice to finally meet you in person. I know, I'm good. I sent her thousands of emails. We work together on something. That's right. Jim. Yeah, Jim. Yeah. Let me give you my. That's so funny. Nice to meet you. I know. But yeah, we just cross over a lot.
How's your master's going?
Yeah, it's my started. Yeah. I just have to like use. I can't leave it all to Jim. I'm trying to do this. Yeah. Hi,
I really struggled last
how are you? Good, how are you? What a lovely day, right? Yeah, it's so warm. I can't believe it. Nice.
No cars and no umbrella yet.
Right.
Yeah. I'm working on the chip research. People like, I'm like, I feel like,
That's what I worry.
because we're on like two of them. So this
How are you?
class.
You okay?
Oh,
What happened?
I swear. It's really not about I wanted to get some time, so some of my tool soccer team. So I think,
And so,
those are the discussion boards, so every day, in the white shorts, so, which is completely covered in that, like, red out on the lights. Steam treated them, and also that part, come on. I don't know if I was thinking, I want to like just like, force myself to put it like, okay, that's so long, and everybody else. Yeah.
it was funny yesterday, I indicated in that class, because he was up there like 7 minutes later.
No,
I was like, I just don't.
So what this wasn't going to show up.
This is the best quality ever.
Yes.
And touch that voice.
Like, city abstracts. Where do you go? And that's what it would be like, how are you? So you just love me, I was shaking my head like, yeah. We met at, after, you know, I think Joy. Oh, thank you. You're inspired, that's a real one. I watched the one. Much better. Yeah. A lot of stuff. And yeah. Yeah. She said, she thought it was well, like, what I would say, because they say it's enough to care for everybody, you know, and then like, all this kind of about that people, she goes, where indication, like, you all know each other, it's all, it's hanging out. And tell everybody, yeah. Either people or like they have. Maybe they just haven't announced it yet. No, she called her and yeah, it sounds nice. But I don't know. Yeah, I was so nervous. Scared to. Yeah, like, this is a big thing. I know, it's crazy. Yeah. Anyway, I think they're getting used to those extra things now. Yeah. That's the way it should be. Like, yeah, so after going through all that, like, the one side, yes, like they're, you know, obviously it's like more work on people, but at the same time, like, they get more so much more. Yeah. And so, this is, I bought it from Costco like a year ago. Oh, very pretty. Yeah, I did hear it. Tell them about it. I think in Florida, it's nice. Sounds like sure. I haven't heard a lot about it. Yes. I mean, actually, I like all of the person. I wasn't talking about it. Yeah. But he's much more hands-on. You think she has any one? Okay. Right. Yeah. Well, yeah, there's also like Charlotte has where they do take a lot of initiative. Right. Yeah. Yeah. Like, come on, man. Have time to do this. Oh, okay. Yeah. He was like a bad guy. He never did anything. Right. Oh my God. While it's like kind of way, that like sort of like decisions that are made, that's like this. Like it's still like oh right, nothing they're gonna do, but I'm not really exactly. It's that they made like a lot more. Good morning. Oh, how are you this morning?
How are you?
Oh, good, thank you.
Good.
Oh, just let me know when you're welcome to.
Yeah. We'll get it done. But, right.
Yeah. You want to do photo? I mean, right. I don't know yet. Yeah. I think I'd be here like HPV transplant. Yeah. Problem is patient. It's removed. Is that? You know, just like your transplant, like, and then
Right. Yeah. It doesn't
We'll wait just a couple more minutes. We won't do it on internal medicine time, which is 5 after the hour, but we will wait a minute or two.
Yeah. Yeah. I would let her just hide my
Yeah, supposedly it's not $3.
Sure.
It'll show up better when it's not dark background.
Like one of those slides. And then you start back on slides.
Well, I think I can change. There's a way to change the color.
You're just learning how to do it, yeah. And you can change the,
You can also make it
simplify what you're, I'm just learning. So, it's a cool device.
All right, you're good.
All right, why don't we start? And good morning. Great. Well, welcome everybody. I'm going to talk a little bit about giving talks and presentation skills, and looking around the room and seeing a number of people that probably have given a similar talk to this, and I suspect any of us giving this talk would approach some of the things the same way, but some of it is going to be a little bit about style and some suggestions that I have about how you might do things. And so I think you should appreciate that there's, for some of these things, it's clearly more art than science, and there may be multiple ways to do different things. So I've subtitled this, How to Avoid Giving Terrible Talks. That's certainly what we want to do. How many have given a talk that they weren't completely happy with in the room? Okay, just about everybody raises their hand. And how many have given a talk at a big national meeting where you were up in front of maybe, say, more than a couple hundred people? Several have done that. How many have been nervous when they've given a talk? I think it's probably good to be a little bit nervous when you give a talk. The problem is you want to try to channel the nervous energy into the talk and try to use it to make it better rather than to have it be a deterrent to what you're doing. So I want to acknowledge a few people who I've begged, borrowed, or stolen material from. And Monica Safford, who for many years was part and principal of this program, was one who did a very nice job with this. And so I've used some of her material and then I've added some of my own, but these are a few of the people that have contributed. So this may be a bit intuitive, but we want to make sure that as academics, as people who are doing research involved in teaching, that we communicate well. And so it's really a tenet of being in academia that you are able to communicate both in verbal form and in written form. So you have to be clear in getting your messages across, and it's important to do good work, to do careful, rigorous work, but if you're not able to explain it to people and get the message out in a clear and concise way, it won't be as impactful. So if you give a bad talk, lots of things can happen. People may not pay attention, they may fall asleep, they might think that you don't do good work or that your work is not important. And if you're out trying to give an interview talk, you might not get the position you're looking for. So that's a problem. If you give a really good talk, people are impressed. They think that you know what you're doing, and they want to hear from you more, and they follow your work with great interest. So part of it is preparation, like everything, and I think this is really actually a fairly important slide. I've seen so many people, even very experienced people, screw things up by not being prepared. And how many have been to a talk at a major meeting where somebody gets up and they've got either the wrong slide deck, they don't have the slide deck, or their slides are all screwed up and they don't know it? I mean, that just boggles my mind, because all you need to do is get there early, preview your slides. And I do this every time I go to give a talk. I always look at my slides because of the Mac PC compatibility, formatting, all sorts of crazy things happen. So just to leaf through them and make sure that your animations are working, that you didn't give the wrong version to the projectionist, et cetera, et cetera. There's lots of things that can happen, and you want to get there early and make sure it's working. The other nice thing about arriving early, particularly if you're going to be in a big room or an important meeting, is look at the setup. I mean, the setups are different. Sometimes you don't have a confidence monitor. If you don't have a monitor in front of you, you're going to end up looking at the screen all the time. You're going to have to do that differently. As the screen may be in a room where the screen is off to the side and it's difficult to see your slides, that may change the way you do it. And you may even want to have a hard copy of your notes and your slides if that occurs. Another thing that's quite helpful, particularly if you're giving a grand rounds type talk or you're with a group that doesn't know you, is to have someone introduce you. And you can prepare a little bio blurb that you can actually pass out to someone that gives a synopsis of who you are. What are the key things that people need to know before you speak, to sort of put things into context, understand your background and where you're coming from. And the other thing you'll notice that I always try to do whenever I can, sometimes it's not possible, is to stand on the right side of the screen. And why is that? Why do you want to stand over here? Because people read from left to right, and so when they get done reading and they come back from the next line, there you are. They look at you and they see you, and then they go on and do the rest. We generally don't like pointers, and I've got some sort of a new gadget here that I haven't quite figured out yet that Brian has just shown me. It doesn't even seem to be working, but it can be really problematic in a big room, because there may be multiple screens, and so people may not be able to see you pointing at one screen. If you can, it's good if you can use the pointer that's embedded in the computer, if you're comfortable with that, and that can be very helpful. The other thing that is really important, particularly if you're going to be nervous, if you're going to be up in front of a big group, this is a big talk, you're presenting new data, is the particular thing you want to spend the most time on are your first few slides, so that you really memorize the beginning of it, and then that gives you confidence and you get started in the right way. And then I'm going to reiterate this point multiple times, but never give a talk you haven't given, and this is really about practice and preparation. And so people that have hotel rooms next to me at big meetings probably don't like me because I do my talks verbally a day or two before, and go through them, and it helps in a lot of ways. I mean, it helps you time it. For many of us, listening to ourselves talk and hearing things that we're saying, in addition to reading it, reinforces things, and we remember things, and it is particularly helpful in the transitions. So it's the transition from slide to slide, from point to point. How are you linking things together? What's the way that things fit together in the talk? So I'm going to start with just some general things about the actual presentation style. Some of this are things that you learn over time, that sort of tricks maybe. Some of these are things that I picked up in working with people that do this professionally, and that if you do press releases or you get up in a setting where you're working in the private sector, they often have people that come in and train you, and these are some of the skills that I've seen them recommend, so I'm going to share those with you as best as I know them. And then I want to spend a few minutes just on the slides and give you some of my biases about that, and some examples of maybe some things that aren't so good. Okay, so we want to keep the audience interested. Things that can affect this are the topic, the depth, the attitude, the presence, and your mannerisms. These are all things that are relevant. Now, the question part of things is often quite intriguing, and that often requires as much preparation as actually the talk. And if you're particularly going to present anything that's contentious, being with some smart people ahead of time and having them ask you questions and practicing the response to those questions can be very helpful, and really trying to anticipate what those questions will be, writing them down, practicing the answers. It's not great to say you don't know, but it's also not terrible either. Sometimes it can actually give people confidence that you're being truthful if you admit that you don't know something. I mean, there's sometimes different ways to answer that. It may be that it's not known. I don't know it, but nobody knows it. That's just something we don't know. Or another common response is yeah, we're planning to do that. That's something that we recognize as a limitation, and we haven't yet done that analysis yet, but we do want to do that, and thank you for mentioning that. So there's different approaches to that, and depending on the talk, it's also good to anticipate, are you going to get interrupted? Are people going to be breaking your talk up? And that can be good in some ways because it creates an interaction with you and the audience, and that's very helpful. But it can also be problematic in terms of your timing, and if you're easily distracted or it's something real new to you, it might throw you a little bit out of kilter. So you have to be prepared for that. And also be thinking about what, if that does happen a lot, more than you expect, what are you going to leave out if you've planned this for a certain length? You don't want to run over. People don't like talks that run over. It's kind of rude in a way, isn't it? Because you're making the assumption that people have extra time to give you, and that your time, in essence, is more important than their time. And people don't like that general attitude that people might bring. Just some general things about knowing where you are. I'm fanatical about having the flash drive with me when I get up in a big meeting room, and just making sure that if something does happen, and many of the large meetings you load your talk in a separate room, but then having the flash drive with you in case there's a problem. So that's important. I think we often underestimate the length of distance from where the audience is sitting to where the screen is. And sometimes, very frustratingly, people will put up font that people can't read. And it really is very, in my view, unforgivable to say, well, you probably can't read that, but. I mean, so why did you put it up if they can't read it? I mean, unless there's some point to just showing a lot of stuff. And sometimes there is, but not often. So don't do that. And think about breaking it up into several slides. How are you going to point? We talked a little bit about that. We talked about some of these other points, okay? All right. Now, the audience. This is really, really important. Knowing your audience. Who are you talking to? Where are they coming from? What do they want to know? And the old adage is, overestimate their intelligence and underestimate their knowledge. So assume that they are smart, but they really don't know the background to what you're talking about, and take it from there. And it's going to depend on the level of detail that you go into in terms of how technical it is, how much statistics you might want to include, where they are. It's often embarrassing when you see people get up in front of a very erudite audience in a very specialty environment and give a very sophomoric presentation about the topic. That looks bad, and people will not take well to that. So what's in it for me? The radio station, WIIFM. What's in it for me? Why are you telling this to me? Is this important? Do I really want to know? So when I talk to clinicians, when I give a talk at a rheumatology grand rounds or a bone club or something on one of the topics that I'm interested in, thinking if I'm an average practitioner listening to this, what do I want to know? What is it that I need to get out of this? How's it going to help me take better care of my patients typically? Or if I'm standing up at a national scientific meeting, what's new? What's the advance that's occurred here that goes beyond what people knew before scientifically? So we talked about the second bullet. And then tell them what you're going to tell them, and then tell them what you told them if your talk is long enough. Now that can be a little bit repetitive if you got, if you're giving an abstract in 10 minutes and you spend all your time sort of outlining it, giving it, and then summarizing it. That can be a little bit repetitive. But certainly in a larger talk, 30, 40, 60-minute talk, you want to try to follow that adage. And one of our colleagues, who many of you know, Jerome Allison, used to always get on me about the conclusion slide. Trying to make sure that you summarize what you said. What are the takeaway points in that final slide that really is very poignant and important? If you're not interested in what you're talking about and you're not excited about it, that'll come across. And this often occurs for those of us who get invited to give clinical talks when we give the same talk over and over again. So I always try to twist it a little bit, give it a little something new that makes me excited about it. Add a few new slides. What came out in the last few months in that field that you can just throw in a few new things? Even if it's going to be the same bullets. If you're not excited, other people won't be excited either. Don't talk down to the audience. You know more than them, but they know more about other stuff. Now, we all see, this kind of thing, people kind of hanging on the podium, right? And anything that feels really good to you is probably not a good thing to do. So, putting your hands like this, both hands in both pockets, sort of these self-comforting gestures are usually not things that portray well. And I think it's really important to, even if you're giving a super data-heavy talk, to try to figure out, as you're practicing, when is it that you're going to break away from what you're saying and look out at people. And it can be challenging when you're in a super big room or you're standing up and there's lights coming in and you really can't see anyone, but just trying to look out and make eye contact and try to interact with the audience can be quite helpful. Yeah, right. So we've seen this before, and pacing, trying to get the cadence right. Similar to the making sure the room is right and the projection equipment is right. I'm also very vigilant about making sure that there is a glass of water, because we've all seen somebody, even the most experienced speaker, and it doesn't have to do with being nervous. It might be have a respiratory illness, or you're in a dry environment, or you took a transatlantic flight and you're dehydrated, but you get up there and you start losing your voice, and that can be very distracting and it can really hinder it. So make sure there's water there when you go to talk, and that can be quite helpful. PA systems. So I asked when I came in here whether there was a microphone. Whenever you can get a microphone, even in a relatively small room. Being able to be heard is just critically important. So being able to project and make sure that everybody, similar to the visual, the audio is important. If people can't hear you, they get upset. And that can be very helpful. Your hands. And this is something that if you do any sort of media training, they'll work with you on a lot. And how do you, what are effective gestures? They tell you, if you're going to show somebody that something is big, illustrate it. Or we're trying to bring things together. There's different gestures you can make with your hands that illustrate what you're talking about. And so that can be very impactful as you do that. And you can actually, as you're practicing, you can work on how you're going to incorporate your hands into the talk, and when you're going to point, and when you're going to do certain things. So this, again, it depends a little bit on the nature of the talk you're giving in terms of how much of that is important. But your gesturing can be very helpful. And we've all seen really good speakers, some who have sort of standard things they do. I think, wasn't this Bill Clinton? Didn't he do this all the time? I'm trying to remember what his gesture was. And, so people have different things that sort of almost become their trademarks. But you may want to watch yourself on video sometime and see how your gestures are working, how your expressions are, how your positioning is. I like to tend to move around a little bit, but I also recognize that if you're moving around too much, that can be distracting to people. If you're just sort of pacing and sort of peripatetic, that's not so good. So you want to find what works and what is comfortable for you and for the audience. We talked a little bit about the laser, and we've all seen people kind of go crazy with it and just paint it all over the room, and it's up on the ceiling and in people's eyes. You can blind people with those things. So you got to be careful with the laser, and usually just a quick point. The people who give the very best talks don't use a pointer very much, if at all. And I found that if you selectively use animation, you often don't need a point. You can just bring the bullet in, and if you've practiced it and your cadence is good, the point comes in as you're bringing it up. Okay, so I think I've covered this. Don't point at everything. All right. Yeah, so this is a problem, right? So people that have parts of their speech, my kids, for some reason, every other word is like. So we work with them. When I talk to them, I repeat that back to them every time they say like, and we try to get like out of the talk. But I think a lot of it has to do with practice and feeling comfortable and confident with what you're going to say and knowing what you're going to say next. But better to pause than to add in a word that really doesn't mean anything, if you can work on that. Practice out loud. Don't read your slides. Now, the pace is challenging. This is a general rule of thumb, 1 to 1.5 slides per minute. Depends a little bit on the kind of slides. If you've got very complicated data slides that you're explaining, and you see basic scientists often show the data, several pieces of data in one slide, and walk through all the different figures and graphs and plots and so forth, that may take a long time. That may be more than a minute. And then I show a lot of pictures. I have just a picture that may take 10 seconds for me. So some of it is just practicing and seeing. And it also is going to depend on how you're feeling when you're giving the talk. If you're super nervous and you just, you're trying to get done, you may go a little faster. And if you're feeling really comfortable and confident and you're getting into it and the audience is getting into it, find you tend to go a little slower. You add a little more and you say some extra things that you didn't say when you were practicing. That may slow you down a little bit. So you want to practice. And then really the key to practice, as I suggested, is the transition. How do you go from slide A to slide B? What's the connection? And that's where having done the talk before, you get much better at it. And then people lose IQ when they stand in front of audiences, yeah. All right, so let's talk a little bit about slide design. Any questions at all, first maybe about the presentation part, or before we get into this, any comments from others in the room who have given a couple talks or two? Pat?
If you're invited to give a presentation somewhere, make sure you know who the audience is. I'm frequently invited to different things, and I don't know the purpose of me being there, or the objectives weren't explained enough to me, or there's idiosyncrasies about the audience that no one informed me about. So I ask a lot of questions now when I speak in front of a group that I don't know anything about. And another thing to keep in mind, I was giving a talk to the Infusion Nurses Society on quality and safety, and I didn't realize how much they knew about quality and safety. I mean, that was something that they were very good at, but that wasn't conveyed to me. But in that talk, I had a funny slide, and I made a political comment, and boy, did I see that on my evaluations. It was like, how dare you criticize our healthcare plan? It wasn't criticizing the healthcare plan. It was showing how complex it was and how complex our environment is. But some, a few people, it wasn't just one, took it the wrong way. And so be careful of jokes that could be conveyed in the wrong way.
Great comments. Other comments?
I've been given the advice not to apologize for minor hiccups, but because it kind of decreases your credibility as a speaker, but instead to thank the audience if you had a technical difficulty for their patience and things like that.
Yeah, that's a really good point. And I always encourage people not to apologize when they're giving a talk. People will, if you have a limitation People will figure that out on their own. You don't need to help them find it. So that's a good point. And I think it's really great if you do know the audience well and you know people in the audience and you're going to have an opportunity to interact, to say, well, Dr. Jones, you're an expert in this. What are your thoughts about this? Bring them in and make them feel a part of it, and particularly if there's people in the room who might not totally agree with your viewpoint, to try to bring them onto your team and to offer them an opportunity to provide some commentary selectively. That can be helpful. Gabrielle?
I think another thing that's been really helpful for me, particularly when I'm doing slides for a new topic, is presenting for like my mother, my best friend in marketing, sort of other people that are outside of the field, because it forces you, as long as they're critical people, it forces you to, they'll say, well, I have no idea what that term that you just used meant. And it really helps me to explain things in a way that everybody's going to understand, as long as you can rope them into doing it.
I think just another comment is a lot of this stuff feels very unnatural when you start, and it gets easier. So one of the things, I have a naturally very soft speaking voice, so I have practiced over the years being able to project in professional settings, because it felt hard. It felt like I was shouting for the first couple of years. But it has gotten a lot easier, and I just naturally do it now. I sort of switch into a different kind of register.
When I was in my doctoral program, one of my fellow students had a really difficult time speaking in front of people. I mean, it was almost panic attack inducing. And so she actually went on, she takes beta blockers before she does a national presentation. I mean, it's prescribed for her, of course. But it doesn't, you know, it keeps her heart rate low and keeps her anxiety level at a lower pace. So if that's a really big problem for you, don't be afraid to get some help.
Right. I think that's a good comment. If you do use a beta blocker, make sure you stay hydrated. You don't want to get hypotensive. Yeah.
I'll add one other minor one. When I was training to give presentations, I was given the opportunity to present in front of a bunch of people, and they actually had one person that was specifically there to count the number of times I said and like and so forth. And it really gives you an opportunity to self-reflect, because I think sometimes we think we don't say it as often as we do. And so that was really useful moving forward. And they teach you to instead breathe and take a pause if you feel yourself, you know, saying or like while you're presenting. So there are techniques out there.
One other comment. So the other thing that I think in terms of looking at your audience that's helpful is if you can either plant somebody that you know in the audience that you can like look at who's an unthreatening person, or, you know, do your initial scan out and find some person that looks like they're smiling and nodding.
Nodder. Find the nodder.
Like look at them, because you don't
Always look out and find the nodder. The nodder is great. There's always the nodder. There's a nodder over there. I'm looking at the nodder, and that's very reinforcing. Oh, one other thing that happens during talks, particularly at big meetings, is people get up and walk out. You know, you're giving a talk and somebody is walking out. Do they not like what I'm saying? Are they not interested? Am I being boring? Did I offend them in some way? But you have to expect it, particularly when there's concurrent things going on. People want to go hear something else. They got your soundbite, and now they're going to the room next door to hear the other presentation that they're interested in. So be prepared for that. And then occasionally, not uncommonly in a big room, you'll get a pseudo heckler. And what do I mean by that? Somebody who's snickering in the corner talking to their friend, and you don't know whether they're talking about you or what they're doing, but it can be distracting. And so you got to be prepared for some of these things and anticipate them when you're giving your talk.
Hey, Dr. Sang.
Yes.
So at one of the previous conferences I went to, so how would you react or respond to an audience who asks you or tells you that he replicated your experiment to the core with all the controls, but nothing came out?
Nothing came out. So your results don't make any sense, because I've done the experiment and found something different.
We found nothing. We found no effects on bone or stuff. And you're presenting this data of your 4 studies.
So thank you for pointing that out. That's an interesting observation. Maybe we can get together after the talk and go over your data and look at that. I'd like to learn more about what you've done and review your preliminary report. So the idea of let's meet afterwards. I'm interested in what you said. We don't have time now to get into the, all the nuances of how we did things differently. That's one approach that you could take. Yeah. Other comments about the presentations? Okay, let's talk about the slides. Convey the necessary information, be understandable, be interesting enough, avoid overstimulation and being boring. So we've been through this. Tell them what you're going to tell them. The talk length corresponds to the outline. We've talked about that already, the idea of the sort of telegraphing what you're going to do. So this is a problem. This is often the way when we're working with people early in their career that the talks come in initially. And I love to go through. I do not write any of my slides in complete sentences. I'm delighted to take out is's and r's and the's and a's. I view the PowerPoint as basically just an outline and no complete phrases in any of my slides. Is the message there enough for me to be able to explain it to people and for people reading it who aren't paying close attention to have some idea of what I'm talking about? And the other thing I do in the title is I reorient people to what I'm doing. It doesn't just say results at the top of the title. It says comparison of drug A to drug B results, so that if they've been listening to 20 talks that day, they're back to being oriented to what it is that I'm trying to give them. Font size, critical. Use the biggest font that your slide can accommodate. Use the full slide. Take advantage of the graphics. Spread it out. Make it bigger. Bigger is better with font. And bold. I always like to use bold. I very much prefer Arial, bold. Those are the two things that make it the easiest to see. This is what this font is right up above. The color scheme, there's different approaches. My preference is a dark background with predominantly white text, some yellow for highlights. I use some light green because that has a good contrast. Other people like a white background with black text. Both of those have good contrast, and the people in human factors engineering say that that is good. We'll talk a little bit more about colors, I think, as we go. So if you can't see, I said this point already, if you can't see this, don't say this. If you look at the handout, if you make a handout page, either 3 or 6 slides per page, and you can't read the text on that slide in the handout, it's probably too small. That's a good sort of rule of thumb for what is the font that's too small. And make sure that if you're going to be in a big room in particular, that you really are attentive to this. Talked a little bit about how to cut the slides back, fewer words. 6 facts per slide is a suggestion that you should think about. Now, so this is not great, right? Too much information. And, I mean, do you need all the rows? Do you need all the columns? Could you make the points that you're trying to make with less information? You have to have all of these contrasts. Are they all as important? If you really need all this, it's probably 3 separate slides to show this information. And to use some animation to highlight the things that are most important. Where were the significant differences in these different comparisons? So that helps, but still too much information. All right, we've seen this happen, and this can be a problem when you're working with different projectors and different equipment. When you go from analog to digital, there can be some problems. Make sure that if you're going to use your laptop, make sure that it connects well and that it's compatible with the projector. Still some challenges with that, despite technology advances. Too many bullets. Right? So this is a problem. Always embarrassing when you've given a talk a bunch of times and you find a spelling error in it. We've all done that. So pictures are very helpful, but they can be confusing if they're not well drawn. And so I use a artist who helps me when I have to make a graphic, and I suggest something, the artist helps. If you have that ability, that's wonderful to be able to get well-drawn pictures, big, lots of contrast. That can be very helpful. You can see the text on the left and then summarized on the right. Much easier to understand than all that text. Figures are better than tables. Pictures are better than figures. So I'm trying to recall exactly what the point was on this one, but I think this is actually reasonable. It's a little bit too small in terms of the font. In a big room, you'd have a hard time reading the legend. I often like, if you can, and again, I don't know that this pointer, let's see if we can get it to work here. Oh, yeah, it's actually working now. Rather than have this down here, I mean, if it's not too complicated, why not just label it up here? Just label what it is right on the figure and avoid having people have to move their eyes back and forth from the legend to the slide itself. Now this is a lot of categories and it's not uniform, so it might be difficult to do that, but you can imagine circumstances where instead of having a legend that says, you know, the blue line is something, the yellow line is something, just write it on the blue and yellow line, make it easier. Similarly on the y-axis, don't make people crane their heads to read the y-axis, flip the text around, put it horizontal so that it's easier to read. Much better, much easier. Animations. Animations can be exceptionally helpful, but they can also be very distracting. We've all seen people over-animate things, right? So you can see this, right? Yeah, yeah. It can be very distracting. So use when you need them and when it really brings in the point, and know about the system. So that can be helpful. Use it sparingly, right? It can be annoying. Okay. All right, so this is a bad drawing. Right? Bad drawing. Fix your lines. Make it better. Yeah, so colors. There's a lot of people that have red-green color blindness, and so red text is not good text, and try to avoid it, particularly on a dark background. Colors look different on different projectors. I'm very against jargon and acronyms, and that would be one of the critiques that I'll provide in reviewing a talk is let's get rid of the acronyms, let's explain anything that's jargony terms that we've made up. You know, we do these studies, we make up all these names of different things we're doing. Explain what that is. Do you really need that jargon to make your point and get it across? And that can be quite helpful in making it easier for the person that's not part of the field or doesn't understand your study at the start. And more contrast, different projectors have different results. You can see some of the challenges here with some of these colors. You got to really work on the contrast depending again on your background. Talked about this a bit. White background, black text, dark blue background, white text. That's my favorite. I'm not a real big fan on all the sort of mosaic backgrounds that you can pull in these different things from PowerPoint that look just terrifically fun when you view them, but they're actually distracting in my view. I just keep the background simple and let people focus on the science, not on the background and all the different artwork that you have in your background. So text, font size. avoid fonts less than 20 whenever possible. Use your color effectively. Use animation to teach. 6 new facts per visual. Declarative statements and titles. Declarative statements. What did you find? What was the finding? Drug X increased blood pressure. Declarative statements. Pictures and graphics are better than words. Summarize periodically. That's something that I often see, and particularly from our basic science colleagues, just lots and lots of data. Give me a summary. I've been, unfortunately, needing to check my email. There's a problem that came up at work. I missed a couple of your slides. Summarize for me. What did you find? What was the main, what are the interim conclusions as you're marching through the talk? And label things very carefully. I can't tell you the number of times somebody puts up a graph and the Y and X axis aren't labeled, and I don't know what they mean, and that's very distracting. Too many words per line, red on blue, get rid of the prepositions, show the full complex figures, that's not good, we've gone over that. Over animate, vertical text, all things we've talked about. Equations. So sometimes when we're giving quantitative science talks, we do need to include equations. If you're talking in front of a group of biostatisticians, this may be perfectly germane to include this level of detail, but for most groups it's not. And so you need to, again, know your audience and understand what they want to know. And this shows, yeah, you're really smart and you know how to do statistics and you understand all this, maybe, but it also means that you're obfuscating what you're trying to do, and it's not, it doesn't bode well in a general audience, a general medical audience, and even a general methods audience if they don't know this jargon, this nomenclature, and don't really care about this level of detail. So do you really need all those equations? It depends on the audience. Sometimes you may need them to explain the variables, give plain text descriptions. The best biostatisticians that we work with are the ones that can talk to people and explain what they're doing in terms that they can all understand, even if they're not biostatisticians. Sometimes the approaches are very sophisticated and it can be very difficult to explain it, but at least to try to put it into simple terms and explain why you chose one approach over another. All right, so we've seen these before, right? Okay, we've seen this. Better to put it in a graph than in a table. But graphs can be a problem too, right? I mean, we've seen these. You've seen people give a talk with this type of data in there that they just haven't really made an effort to try to summarize in a more concise way. So this is a common problem. All right, so nothing is perfect. And for those of us who do clinical science, we often spend a great deal of time apologizing for our limitations. And that happens in the paper, it happens in the talk. And it really kind of beats the reviewer to the punchline. What are the things that you recognize are limitations of what you did? And this, in an observational study, is critical. Because if you over-interpret your results, people are not going to have confidence in what you say. And one of the biggest challenges is people suggesting causality. We see this all the time with talks from observational data, sometimes not even prospective observational data, where somebody says, instead of an association, they says this, this caused that, or the implication is that it was a cause and effect relationship. And those who have studied epidemiology know how difficult it is to establish causality, and it's often through repetitive studies and often with much more rigorous study designs that we ultimately can feel more confident in some suggestion of causality. But be conservative. Even, I always think that it's better to underplay your results. Let your results speak for themselves. Underplay them and try to not overstate anything. It doesn't reflect well on you. So, the summary, if your talk is more than 5 minutes, it's nice to summarize, bring people back, remind them why you're great, give the selling points, what's the public health implication as so there's a summary slide that says what you found and summarizes, and then there's a conclusion slide that provides a broader context for it. What are the implications of this? What's going to happen next? What does this mean in terms of public health? If it's possible to put it into that context. So this is great. It includes, some things that you want to highlight, but you can overdo this too. So good presentations, interesting topics, explained at the audience level. The slides are understandable and easy to see, reflect well on the speaker. And I will conclude there. I'm delighted to have some more comments on slide presentation from our other experienced speakers in the room. Other thoughts, suggestions?
I have a question. Oh, sorry.
Go ahead.
I have a question regarding jargons and acronyms. Personal. I use a lot of trabecular bone microarchitecture.
Yeah.
So when I write it in the title, like trabecular bone microarchitecture is lower in teens with postmenopausal osteoporosis. So
it's a long term, and if you had to say that every time, it would take up most of your slide each time, right?
Yeah,
so it depends again on the audience and how much they're paying attention. So you might introduce it initially with an explanation, then give the acronym. If you're talking to people that are in the same field, it's going to be a lot easier because they're going to know what trabecular bone microarchitecture is, and they may like TBM or whatever you're going to use. But it's not a bad idea somewhere in the middle of your talk to redefine it, because maybe they've spaced out and they haven't been paying close attention. They forgot what it meant. So why not reintroduce it later on? And if it's a little shorter, you could say it and not have to use the acronym.
I was going to say, with regards to presenting graphs and tables, I always find it really obvious when people are copying and pasting from a manuscript or a dissertation onto their talk, and just sort of underscoring the importance of fitting your table or graph into kind of the aesthetic of your talk and reformatting it so it's
it looks like you put in a little extra effort. So you do get a little credit for effort if you've made it an attempt to try to make it easier to read, to try to clean it up. That can be very helpful to people, and they appreciate that.
Yeah, a lot of times when you copy things, they come out really blurry when you're in a big room with a big screen. So you have to be really careful about that. A lot of times when you copy graphics off the web, it's, they come out really blurry. So just, take a look at that. Another thing is, our school, the School of Nursing, wants us to use we have a branding toolkit. So there's set slide formats they want us to use. It has School of Nursing on every single slide. And sometimes that gets a little boring for people. And sometimes we're asked not to do that, depending on the conference. They don't want your school listed on every slide because they have their own slide format. So just find out from, where you're presenting if it's acceptable. If it is acceptable, it's kind of nice. And sometimes for audiences that don't know anything about Alabama, which is most of the country, I have a cute little slide that shows where UAB is and where UA is and where UAH is and how we're, 3 different schools. And we're not the football campus, we're the medical science campus and stuff like that. So that kind of gets the audience knowing, where we're from and who we're about. But, see what your school wants you to do regarding those branding things.
The school and the meeting. And the meeting often will have very specific requirements about how you use logos. The second slide is generally your conflicts. Sometimes you have learning objectives. Depends again on the meeting and what they're going to require. They may want some key references. The acknowledgement slide may have certain requirements.
a trick for using colors is if you print out your graphics in black and white and you can still read them, it's generally okay. That will generally be good enough for people who have some sort of blindness or, just if the contrast is off on your screen.
I was going to say, you kind of said this in some ways, and this may be a style thing, but I tend to put much fewer words and sort of use them as cues for what I'm talking about, because I think particularly when people are starting off, they tend to have these sentences in there, and so, which then you end up repeating instead of using this as a speaking point, because you want the audience to look at you, not to be, reading, your slides as much.
And I like the comment you made about bringing a hard copy. of your slides. I mean, you don't have to bring your notes, but even the six slides per page, I always bring that with me because you never know, there might be a power outage at the conference site and you're gonna have to just do without slides. So how are you gonna remember what's on your slides if you don't have something with you?
Good comment. And it actually reminded me of another point that the professional media trainers make, and that is to extinguish what's on your slide. So people read the slide, so help them get through the slide and then illustrate with additional things that you want to say afterwards. So get through all the content on the slide and then provide the narrative and commentary on that while they're reading. Because, you know, if you're talking while they're reading, then they're not hearing always what you're saying.
One observation about acronyms, there's certain things that are needed to be said again and again and again where an acronym might really be good. But I see this in writing too. There's a title and then you put in parentheses, here's the acronym, and then you never use it again. That's distracting. It makes someone try to have to keep up with what this thing is, and if it's not really essential, it's probably better to get rid of the acronym.
Good point.
I have sort of a specific question. So I have a paper session coming up where I'm presenting results of a review. And like, I'm just racking my brain, because, you know, in my paper I have a summary table of all the papers and all that data. But like, how do you make that interesting and not too much in the slide? I don't know if anybody else has sort of...
So reviews are challenging, right? Because you've got a lot of data, a lot of information, and often forest plots showing different outcomes across different studies are one way to do that. Those can get tedious too, though, when you see all the different point estimates across the different studies. That's what's done in meta-analyses and systematic reviews, is to use a lot of forest plots. And then summary slides. You know, what were the, you know, for this piece of it, what were the key conclusions, and how did the studies in general compare and contrast across these different dimensions that they were looking at? So I think that would be one strategy that you might consider.
So regarding the quality of images, so now, I mean, there are some software like GIMP where you can increase the pixel per inch. So say if you're copying any image, and say if that was a JPEG, but if you save it as a PNG, that allows you to edit the image, then you open that image in GIMP, and then you can scale that. And sometimes you need to lock the aspect ratio so that the pixels are going vertically and horizontally with the same aspect ratio. So there are ways to work on the quality of the images.
Yeah, I mean, there's technologic advances, right, that allow us to do a better job. Audience response can be very helpful, really keeps people engaged. Using some of the features in PowerPoint and other presentation softwares that allow you to customize the talk, where you can click on things, and if you're interacting with the audience and you want to go off on a tangent, if you're presenting clinical material and you're asking people what they want to do, you can highlight particular things that they might do as part of a diagnostic evaluation, and that's a very nice approach.
And also have background slides, I mean slides that are hidden, that if people ask you certain questions and you're anticipating those questions, have a few slides at the very end that you can refer to and show them.
Great. Well, thank you all. Break early.
When they do their first presentations, I see everyone else's mistakes. And it's a fun way to show them that that's not right. Why do they do that?
So what's the due date again?
It's March 26th, I believe. And, there's so many issues. I mean, it's good that we have some collaborations. I've gone